welcome back. Amanda, thanks for helping out. How's it going over there in Blogland?
Busy, like usual.
So it's a pretty gray and not so warm day out there here in the middle of summer. I wanted to talk about your body's internal temperature, however, and I want to talk about several other factors related to that, including energy levels, ability to maintain weight, overall how the hormones are and stuff like that. So the topic of today is regarding the thyroid. Now, nothing I'm about to say has been evaluated by the FDA and does not in any way override what your physician has told you. However, I do want to give you a little bit of the truth regarding, in particular, the thyroid gland. There's a lot of misconceptions and there's a lot of misinformation out there about the thyroid. I just want to get down to the bare bones, basic concepts regarding the thyroid. The thyroid is a pretty important little gland. And do we have, you like that laminated thing with the pictures on it? Yeah, let's see if we can get that. So let's talk about the thyroid and what it does and how it works. Thank you, Amanda. So, I love this little guy, this particular document. This is the thyroid. You can probably see it right there. Hopefully that's showing up all right. Essentially, this little guy does a lot of stuff. However, it is not the be-all and end-all, and there are things in your body that determine the thyroid's function, as a matter of fact. So one could treat the thyroid, and if that's all they treated, they would probably end up a little bit of a dead end and treating it for the rest of their lives. Maybe you know somebody who has been given some kind of treatment for this, and for some reason it just never stops. You know, certain medications that you start that, and the body doesn't think it needs it, and then it actually will cause the thyroid to atrophy and go away. Anyway, so I want to talk about the thyroid. So you could have an excess functioning thyroid, you could have an underactive thyroid. There's hyperthyroid and there's hypothyroid. You can read more about these. There is a really great newsletter that's on our website called The Thyroid Story. Feel free to go to the newsletter section there. Also, you could go onto Amazon, and there's this book, Oriental Medicine and You, which discusses thyroid function in pretty decent detail, along with many other things. So those are some great resources for you if you want to learn more about this. Now, as far as the thyroid goes, it has many things that it is in charge of. Body temperature, energy levels. It also deals with your metabolism, bone density. There's a number of things that the immune system has somewhat of an involvement with. And basically, the thyroid releases certain chemicals into your bloodstream that travel around and do many things as far as those issues I just discussed. So if you're feeling fatigued, it doesn't necessarily mean the thyroid is involved, but it is possible that the thyroid is involved. Now, as far as the thyroid goes, I just want you to realize there's underlying issues and relationships in the body. The thyroid is not the be-all and end-all of everything. Even if you had thyroid blood work done, it may not read totally accurately. It is not the most definitive test you could check for thyroid function. There are tests that can be done if you want. You can contact me. You could come in and have an exam, and we could find out more to give you more of a definitive answer. But here's the basic idea. In your body, you have a system known as the kidney and adrenal system. That system is in charge of producing the raw materials for hormones that would, basically go up to the pituitary, which is in your head, and the pituitary then releases certain hormones, one of them being, for example, thyroid stimulating hormone, TSH. That hormone is the hormone that actually causes the thyroid to work. Now, if you just think about that little synopsis, you'd start to understand the importance of seeing the whole body instead of just one little piece of tissue known as the thyroid. Funny enough, in most cases when the thyroid's involved, it is not the actual problem. There's something under the surface causing the thyroid to give you problems. Anyway, I just wanted to clarify a little bit more about the thyroid. If you want to learn more, feel free to check those resources. You could always call us or email me or whatever you want. We're here to help you and interested in seeing if you can learn more about your condition, if you have any of those symptoms, or you just want to learn more about the thyroid, or maybe you know someone who's had some thyroid problems. Anyway, there's some definitive information regarding the thyroid. Thanks a lot for taking the time. Over and out.